Hello students, Instructor Pamela here. Welcome. I would like to give information on medical assistant and what to expect as a medical assistant. Um, Many of us know most MAs are found in outpatient physician settings, and they can be considered partially clinical. That's what I like to explain. They're clinical and non-clinical because they perform both sides of the functions. For example, when patients are checking into their physician visit, they are called back by the medical assistant. The medical assistant will then verify if that is the patient. They do also weight checking, asking how tall they are, taking their blood pressure. Then they begin to do the first part of the assessments before the physicians. So medical assistants do have patient care contact, so that is super awesome because they get an idealism of what it's like to be clinical. Also, some medical assistants perform phlebotomy functions as well. So depending on the jobs that you may obtain in the future will determine the different functionalities that you can be performing, which brings me into the administrative side. So depending on the size of the facility or the doctor's office or whatever outpatient facility you may be working at will also determine what type of jobs you could be performing on a daily basis. For example, you might be doing check-ins. Some medical assistants will sit in the front and they will ensure that patients are signing in, that patients have their IDs, they're collecting co-payments, answering telephones, and this is also going on while they are calling patients and doing their pre-assessment clinical checks as well. Some MAs also can perform some of the beginning billing tasks because they work with what we call the encounter forms. And a lot of medical assistants and coders and billers are very familiar with what encounter forms are. You'll be seeing them on a daily basis, whether if it's clinical, meaning, I'm sorry, not clinical, whether if it's electronic or whether if it's manual, meaning you're writing with a pen or you're typing with or using a stylus. Either way, same thing. Your encounter forms house all of the procedures and the diagnoses that the clinic that you work at or facility offers. So it's much easier and streamlined for the physicians as well as the medical assistants and the billing staff to be able to indicate why patients are being serviced. So, please understand in a medical office there are many functionalities that need to be performed, and there are a lot of job sharing in between the different positions. So if you're front desk, you might be medical assistant. If you're a medical assistant, you might be doing back staff work and front staff work. Please keep in mind that coding. Many coders don't exist too much in physician offices. Why, you ask? Well, because of that encounter form. The physician has all of the services they provide, so all they do is mark off, indicate, check, and pass it on to the biller or MA to go ahead and input those charges into the system. So, an MA can also be a coder too, quote unquote. So, medical assistants wear many hats when they begin their career within physician offices, and especially as they move through different modalities and through their career. So, keep in mind that understanding the entire revenue cycle from front to finish, from registration to checking in to coding to billing to collections and to patient care is a big part of a medical assistant's daily job and activities. So thank you very much for listening. I hope this gave you some clarification on what to expect in your medical assistant career, and coder and billers as well. And until next time, Instructor Pamela here. Journey well. Take care. Bye-bye.